Good morning. Good morning, everyone. If you could take your seat, we'll get started. Is this on? Good morning. Good morning. I'm going to get the mic adjusted. Can you hear me in the back? Yes. It's on now? Great. Well, good morning, and I want to welcome everyone that's here from the University of Utah, from the community. Special welcome to our athletic training colleagues from Weber State who brought a bus down with 50 people. It's my pleasure to welcome you to the College of Health's J. George Jones Jr. and Velma Rife Jones Distinguished Lecture. My name is Dave Perrin. I have the honor of serving as Dean of the College of Health here at the University of Utah. I am very grateful to the Jones family for the endowment that enables us to sponsor this lecture series. Today we explore a topic of great interest to sport participants, medical personnel, parents, the media, and others: sport-related concussion. The topic is especially timely given Sunday's Super Bowl. Yet we should be reminded that sport-related concussion occurs all too frequently in a variety of men's and women's sports, including ice hockey, skiing, basketball, wrestling, lacrosse, field hockey, soccer, and many others. My own interest in sport-related concussion was heightened with my participation at this mild brain injury summit in 1994 in Washington, D.C. The summit included some of the nation's leading authorities on what was known about sport-related concussion at that time. Last week, I attended a meeting at UCLA entitled Sport-Related Concussion, A New Era of Scientific Collaboration, sponsored by the Pac-12 and the NCAA, and it was absolutely amazing to see the growth and interest in scientific inquiry in sport-related concussion that has happened since that summit in 1994. Today, we are pleased to have as our College of Health Jones lecturer someone who has had a major impact on that expanded knowledge base related to mechanisms of sport concussion and return-to-play decisions following injury. Dr. Kevin Guskiewicz is an athletic trainer, neuroscientist, and nationally recognized expert on sport concussion. At the University of North Carolina at Chapel Hill, he is Dean of the College of Arts and Sciences, the Keenan Distinguished Professor of Exercise and Sport Science, co-director of the Matthew Gfeller Sport-Related Traumatic Brain Injury Research Center, and director of the Center for the Study of Retired Athletes. We have some retired athletes who might have an interest in this. Dr. Guskiewicz earned a bachelor's degree in athletic training from Westchester University, master's degree in exercise physiology and athletic training from the University of Pittsburgh, and a PhD in sports medicine from the University of Virginia. In 2011, he was awarded a prestigious MacArthur Fellowship for his innovative work on the diagnosis, treatment, and prevention of sport-related concussion. We also have a distinguished panel of professionals who have an interest in sport-related concussion from a variety of perspectives. Following Kevin's presentation, the panelists will join him for discussion and a Q&A session. Dr. Chris Hill is University of Utah Director of Athletics. Dr. David Petron is Team Physician for the University of Utah Athletic Teams and CMO Head Team Physician for the Utah Jazz. Dr. Deborah Yergelin Todd is Director of the University of Utah Cognitive Neuroimaging Laboratory and Principal Investigator on a Pac-12 Brain Imaging Grant. Mr. Eric Yoakum is Head Football Athletic Trainer here at the U. And Mr. Kip Smith is former Head Athletic Trainer at Indiana University and now a Big Ten Conference Independent Medical Spotter. So, let's get started. Please welcome Dr. Kevin Guskiewicz.
Great. Thanks, Dave, for that wonderful introduction. It is a pleasure to be here with you today. I want to also thank Dr. Perrin for attending that summit in 1994 because it was at that time that I was a doctoral student at the University of Virginia under Dave's tutelage, and I was trying to identify a dissertation topic at that time, and Dave came back from that summit, and we began a conversation around the next 2 years of my life, and it was because of his wisdom and foreshadowing as to really where this was going to become a very important topic, one that would yield probably research funding over the next couple decades. And so I took the advice of my mentor. So for those of you in the room, students, listen to your mentor. 95% of the time they're going to be spot on, and Dave, you certainly were in that regard, and I'm indebted to you for that. So again, it's really a pleasure to be here, and I'm going to sort of walk us through sort of where we are, and the title that I've given this, the state of sport concussion, legitimate concern versus paranoia, I think resembles that of what other disciplines, scientific disciplines, are struggling with. And I'm going to start this story off with a picture of, I'm not sure, does anybody know where this hotel, famous hotel is? In Stockholm. That's the Stockholm River there. And I had the great fortune when I became dean to attend, actually I was senior associate dean at the time, to attend a black hole summit. And you might be wondering, what in the world would a concussion researcher be doing attending a black hole summit? Well, it happens that two of our faculty in physics and astronomy at UNC Chapel Hill trained with Stephen Hawking. And this is Stephen Hawking on the stage giving a lecture with 3,000 plus in attendance just 2 years ago, and where they brought together the world's leading theoretical physicists, astrophysicists, and discussing the challenges around black holes and these quantum black hole theories. And they positioned me at dinner 2 nights in a row, positioned between Stephen Hawking and Leonard Parker, arguably the two leading experts in the world on this topic. And let me tell you, I knew about this much about black holes when I got to that conference, and I know about that much. But it was a fascinating experience, and I'm going to bring this full circle toward the end here to tell you that this has been a controversial topic, black holes, and so is concussion, and the sort of later life consequences of concussion. And what I learned after spending 3.5, 4 days in Stockholm with this amazing group of 30 of the world's leading experts on this is that it's okay to have good academic debate, even if the science hasn't evolved to the point where we can say definitively that this is what we know and this is how we need to manage this injury or this topic, and that we have to trust that the science will evolve, and that's what actually happened, and I'll bring it full circle toward the end here. So off the black hole topic and on to concussions, that's what you came for. So you can pick up a newspaper in any given week or watch the nightly news or turn on ESPN in a given week, and you're pretty sure that you're going to hear something about concussion in sport. It remains a hotly debated topic, one that we continue to learn from. These are just a few sort of, you can put in, concussion, Google it, put in neurodegenerative trauma related to sport, and you'll get all sorts of stories. Now, what I worry about is that the media, while they've done a very good job in helping to create an awareness for the lay public on this, I think we're a much safer sport society today than we were 10, 15, 20 years ago because of that awareness. But at times the media has also sensationalized this, and which is why I mentioned legitimate concern versus paranoia, because I think you're going to learn from what I'm going to say here today is that I don't think it's nearly as bad as what at times the media has made it out to seem. And so we're going to walk through that. I was given an opportunity to attend this debate that was held at NYU back 5 or 6 years ago, was held by NYU, and Malcolm Gladwell, famous author, Outliers, Blink, a number of other books, along with Buzz Bissinger. Buzz Bissinger wrote Friday Night Lights, and they were debating against Jason Whitlock, a sports anchor, and Tim Green, who played a number of years in the NFL and has written a number of children's books on sport. Gladwell and Bissinger were arguing that we should ban college football. This is the author who wrote Friday Night Lights. And when they entered the auditorium before this debate, they took a poll of the 200 members of the audience, and as they walked into the room that night, it was the polls said about a 70 to 30%. 70, no, you shouldn't ban it. 30, we're thinking yes, maybe ban college football. By the end of the debate, the 2-hour debate, Gladwell and Bissinger had nearly flipped this, and it was about a 60-40, 60% in favor of actually banning college football. And I was not able to attend this because I was actually giving a talk at the Fiesta Bowl Summit this same week on a panel with Mark Emmerick, and I put this up. Mark Emmerick, you may know, runs the NCAA, and I put this slide up there just to bait him. I wanted to see if he could, what his thoughts were on it, and I think you probably know where he stood on it. But I think his point was that we need to continue to improve safety in sport, and I think we've come a long way in doing that. But a lot of the issues, a lot of the questions that are raised is what are the cumulative risks for young athletes? Should kids continue to play collision or contact sports? And I go back to some of the amazing things that sport can create for our society, and especially for young kids. The Surgeon General, back in 1996, at the peak of the childhood obesity and diabetes epidemic, in his physical activity and health report in '96, challenged society, the policymakers, the exercise and sports science research community, and public policymakers around physical activity, physical education programs in the secondary school levels, to really ramp it up and to try to find a way to help combat childhood obesity and diabetes. And so you can see some of the statistics here. But as a result of this, I think we've made a lot of progress. But in fact, in 2013, for the first time, we saw a leveling off and a subtle decline in the incidence rates of childhood obesity and diabetes for the first time in 3 decades. And but of late, we're seeing, and if you look at the data from 2016, 15 and 16, we're seeing kids being pulled more and more out of these physical activities, and a lot of it has to do with, I think, the way that the media has created this paranoia around concussion, many calling it a concussion epidemic, and I'm going to talk through that. I think we need to increase physical activity without increasing injury risk, and so it's the role of many of the people in this room, and we bear the burden of trying to find ways to keep kids physically active but safe while participating in sport. And that's really why I'm passionate about the work that we do. And I want to emphasize that concussion is not just a football injury, but yet it's the model that for many years myself and other researchers around the country have used football as a model to study this injury. But if you look at some of the latest data, concussion incidence rates in other sports, and I'll share some of that with you, you'll see that, yes, while football ranks near the top of that list, there are many other sports. Equestrian sports, for instance, is one which I realize it's a very, very small percentage of people that participate in, but high concussion incidence rate and more catastrophic TBI, traumatic brain injury incidence rates. And a lot of concussions occur on playgrounds and falling off of bicycles, and so we try to emphasize that we got to continue to think broadly about this issue of concussion in sport. The rates, if you look at this, these are some recent data from a good friend and colleague of mine, Dawn Comstock, who's at the University of Colorado, and she runs the National High School Sports Related Injury Surveillance System called High School Rio. Some of you, if you're here and you are involved in athletic training at the high school level, may participate in this surveillance system. But you can see these are ranked 1 through 12 here in participation, overall rate. But what's interesting, if you look at the rates in practice, you'll see that sports such as cheerleading, fall right behind that of football. This is how we can use good injury surveillance to change policies. And I think part of the issue here that Don and I have talked about over the past few years is that cheerleaders don't always have safe practice space. Cheerleaders, a lot of these concussions occur on tile, asphalt, concrete. And so they're changing, the National Federation of State High School Associations, they're using these data to change policy. And I think that's really important. I think it's why we're going to continue to see improvement in these statistics and reduced concussion incidence rates. Following along with Dawn Comstock's data, and I just had a chance to see at a conference a few weeks ago her 2015-16 data, and it pretty much mimics this, and I need to get the updated slide. But a lot of people would argue that this perhaps is a concussion crisis that we saw here beginning around 2009 to 2011, where we see this significant increase in the number of concussions that are being occurring in high school sport. And I would argue that this is absolutely not a concussion crisis. This is a result of 50 states now, and the District of Columbia, so 51 state concussion laws that began with the Lystat law in Washington State beginning in 2009 up through 2014, sort of this wave across the country of state concussion laws that have three primary goals. And nearly every state concussion law mandates no same-day return to play or practice, no return to play without a return to play protocol, a written protocol that involves the sign-off of a clinician with concussion management before they return to play. And third, and perhaps most importantly, concussion education for not only the athletes, but for their parents and the coaches at their schools. And nearly all 50 states now has some version of those three components. And I think that has increased awareness, and it has emphasized that the kids need to report these concussions. The schools are responsible for identifying them. And in fact, I think that we've closed the gap on the number of undiagnosed concussions and diagnosed concussions. And so this is really a reporting issue, and I don't think that there are more concussions occurring on our playing fields today than there was 10 and 15 years ago. So I just want to emphasize that. And some have said, what about this little sort of drop-off here that we're seeing in 14-15? And the way that Don and I are interpreting this is we're seeing, this is actually good news, we're seeing fewer within season repeat concussions, and it's because of better management practices. That rate is down to like 2 or 3%, where a decade ago it was approaching 20% of within season repeat injury. So a kid that has a concussion earlier in the season sustains a second one later in the year. That nearly 1 in 5. That was the case before, but oftentimes these kids were being put right back into play in the same game or perhaps within the same week. And this slide here kind of illustrates that. If you look at the data from just 2007, 2008 that I've highlighted in red here, if you look at this, almost 30% or over 30%, if you add that all up, that those kids were returning to play within 6 days of their concussion. Today, that's at the high school level, it's unheard of. In fact, it's pretty much unheard of just about any level of play. We are seeing on average now athletes being withheld, even at the professional level, with the concussion protocol, being withheld for 9, 10, 11 days. And you can see if we jump out to 2012, 2013, we're seeing less than 10% of those that were returning within 6 days at the high school level, and the new data suggests that it's actually less than 3%. So again, I think this is where education coupled with legislation has been effective, and I think is really a game changer for us. So I'm going to shift gears a little bit now and talk about the sort of the long-term effects of concussion, because this is where a lot of I think it's important have our eye on this. We need to continue to study not only our youth athletes, but also the likelihood or the possibility that someone with repetitive concussions or repetitive subconcussive impacts sustains or experiences some of these later life consequences. The question is, what is the true incidence, risks, the latent pathophysiology that can lead to something such as chronic traumatic encephalopathy, so CTE? How many people saw the movie Concussion? Okay, nearly everybody. That movie probably should have been called CTE, not Concussion, because it was, as you know, it was basically about this condition which we're learning more and more about, but still we have a lot more to understand. Today, as we stand here, we do not understand the true incidence or even the way in which it presents in vivo. We need more prospective longitudinal population-based studies to really fully understand this, and there are some good studies that are currently underway that are allowing us to better understand this so that we can study athletes who are playing at age 20, 25, 30, and to follow them over time to see what they look like at age 50, 60, 70. And it's going to take a combination, I think, of that sort of longitudinal prospective study that takes a very long time and it's very expensive, but also cross-sectional studies where we can compare a 50-year-old to a, that played 8 years of in the NFL or the NHL, and compare them to someone who perhaps only played at the high school level so that we can see what the dose response of those concussions and or subconcussive impacts are. So it's going to take time. Some of our earlier work is, and yeah, I put this slide, I do this on purpose, I put it on a diagonal so I hope to see heads turning like this. That's how I know that everybody's staying awake. So if I see everybody should turn their head to read that title, I did that on purpose. This is a study we published back in 2005 that looked at, and we had at our Center for the Study of Retired Athletes, we've been studying since 2001 nearly 4,000 retired NFL players in a database that ranges from former NFL players at age 24 up through, we actually have a 94-year-old former NFL player in our database. And we started this with a general health questionnaire that was corroborated with medical records from a sample of the team to know that the information that we gather on these around general health of these former players through these surveys is actually pretty accurate, even recalling events from several years prior. But what we found in this paper published in 2005 was that those former NFL players that had 3 or more diagnosed concussions during their professional playing career were likely to have also had at least a concussion or 2 during their collegiate career, and that they were more at risk after the age of 50 of developing mild cognitive impairment, a 5-fold risk, 5 times the likelihood of developing mild cognitive impairment, which is a precursor to Alzheimer's disease, relative to those former players that had no prior concussions. And so this was sort of began to set the foundation for these more prospective studies. A study just 3 years after that, we published looking at that same cohort, the same group of athletes, former athletes, and looking at depression as opposed to mild cognitive impairment. And with this group, we found that those with 3 or more prior concussions during their professional playing career had a 3-fold risk of developing or being diagnosed with depression after the age of 50 relative to those with no prior concussion history. And again, the important piece here, and this is why when we start talking about CTE, is that these are diagnosed concussions. And I'm a believer, and I think the studies are beginning to show this, that there's something very different between the diagnosed concussions that causes impaired brain function as opposed to some number, you pick the number, 50, 100, 1,000 of those subconcussive impacts that players will withstand during their career, that some members of the scientific community have wanted to just count those in the same way that we count diagnosed concussions. And the data are suggesting that they're 2 very different things. And the pendulum has swung to the point where a lot of people just assume that, well, if I played for 8 years in hockey, football, lacrosse, you name it, and I've had that exposure to these subconcussive impacts, I'm doomed. And that I can tell you, there is absolutely not one published research study that proves that. And I think we have a lot more to learn, and I worry that we're talking these former athletes off the ledge because they read a newspaper article and they think that they've got this disease. So every year, and I'm really surprised because it is Super Bowl week, every year, usually the last week of January, the first week of February, you'll see something published like this that I highlighted. This was 2 years ago, and where an article comes out talking about the dangers of playing football. And this was one that looked at former athletes, professional athletes who started playing football before the age of 12, comparing them to those that started playing football after the age of 12. They sort of picked this arbitrary age of 12 and found that on 2 or 3 cognitive tests that after the age of 50, there was a difference between these two groups based on when they started playing football. And this was a highly criticized paper that just from the design, but and why the arbitrary age of 12 and the fact that on most of the tests they actually performed equally. So, but it made a headline on Super Bowl week. President Obama weighed in on this at least twice during his presidency when asked about concussions in football, and you may have seen this. This was abstracted from an ESPN article. And Tony Baselli, who did play for a number of years in the NFL, responded to this by saying that he too is a big fan of football, and that like President Obama has 2 children, he has 2 boys, and that he did allow them to play football, but that he'd have to think long and hard before he'd allow them to get involved in politics. And so that was his response to it. And I use this only to suggest, and let me just say that I'm a fan of President Obama, but I did send him a note suggesting that he might want to stick to the politics and not the concussion research. But at any rate, the point here is that everybody has an opinion and wants to weigh in on this, and we just have to be careful what the source of the recommendation is. This is a paper that we currently have in review, and this illustrates in some way the point that I made earlier, and that is that there's something different about diagnosed concussions and repetitive subconcussive impacts. I'll explain this to you in the most simple form. This involved 32 former NFL players who played 7 years in the NFL in addition to their 4 years of college football, comparing them to an age-matched cohort, average age of about 55, average age of 58, to an age-matched cohort who only played college football. So they didn't have that additional 7 years of football exposure where they had sort of those repetitive subconcussives adding up over time. And the only comparison where we found a difference is this one where you see this hyperactivity. This is a functional image. It's called fMRI. We put them in a scanner and we had them go through a cognitive task, a quick memory task. And what we found was it was only comparing the high concussion group to the low concussion group where we saw this inefficient recruitment of neurons and this sort of hyperactivity that you see. The added exposure, when we compared the college-only players to those that had the additional 7 years of exposure to football, there were no differences. You can see just some subtle, real small regions here that were perhaps inefficient. But so again, I just emphasize that I think the pendulum has swung too far. We need to stay focused on preventing concussions and from managing them properly when they do occur, and trying to mitigate those subconcussive impacts, but not assuming that just because you play for X number of years that you're doomed. So that leads into a couple slides here on what is chronic traumatic encephalopathy, since it's been all over the news and we've heard so much about it over the past several years. It is a progressive neurodegenerative tauopathy. Tauopathy is so tau proteins bind to certain regions of the brain and sort of shut down the pathway and the ability for the interconnectivity of these neurons in a region. It's been described by some that it perhaps analogous to Alzheimer's disease, although Alzheimer's disease involves beta amyloid protein deposits in these neurofibrillary tangles that occur within the neurons. But with the tauopathy, which is really, and let me also add that this is not a new diagnosis. This is not a disease that was just discovered within the last 15 to 20 years. It was actually diagnosed in 1928 and for the first time published in an article there looking at boxers. The movie Concussion and about Bennet Amala, Bennet Amala was the first person on autopsy to find this tauopathy and describe it in a former professional football player. But he did not discover this thing called CTE, or this disease called CTE. But to date, it can really only be identified on autopsy. There's no imaging. We're getting closer to having PET imaging where we can trace this tau in the brain. There are a couple papers here over the last 18 months that have, in small sample sizes, that are suggesting there's promise that we will soon hopefully be able to see this in vivo. But it is distinct from Alzheimer's disease, separate from permanent post-concussion syndrome, and really an important area for further study. On autopsy, what it looks like is they take these very, very thin slices of brain tissue, and they see these dark, and they stain it, and the stain brings out these regions of the brain that have the tau. And one of the questions that's been raised is if you think about the undersurface of the skull with these roughened edges of the ethmoid bone and the sphenoid and the fossa that you see here, might that be causing, with the repetitive impacts and concussions, sort of a disruption of the tissue that causes the proteins to aggregate along these regions? And so again, this is something that needs to be further investigated, but again, it is different from what we see with the beta amyloid deposition being in much deeper regions of the brain than what we see here. In terms of the gross pathology, what we see here on top is a normal, healthy brain, and then in the advanced stages, what we see, and this is where it does not differ much from Alzheimer's. You'll see the cerebral atrophy. You'll see the medial temporal lobe that is atrophied, thinning of the hypothalamic floor, cavum septum pellucidum. This is where you'll see the sort of a larger opening in the middle there. You see the dilation of the ventricles, those two openings. And so this is a diseased brain that, again, that does not look much different from what we see with an Alzheimer's patient's brain. The controversies around the sort of histopathology of CTE, complex nature of the proteins involved, and the incompletely understood genetics of the neurodegenerative diseases raises a lot of questions. Again, similarities between clinical, pathological, and immunohistochemical findings in diseases such as frontotemporal lobe disease, Alzheimer's disease, and ALS. So what some of the neuroscientists are saying that study this is that CTE is really just a subclassification of one of these, probably of frontotemporal lateral disease, so FTLD. But what we know is that there are currently very small and potentially biased samples. Some individuals have gone as far as to saying that there's just insufficient evidence to establish a causal relationship between sports participation and the existence of modern CTE. There have been more critics of this, saying that we've put the cart before the horse. In fact, there was an article published within the last year with that being the title, CTE, put the cart before the horse. I think I have a slide on here. But just a lot more to be learned about this. Does playing youth sports cause CTE? Well, looking at the data from just 2012, 2013, more than whenever this really began, the controversy really was heating up, more than 7.7 million high school students participated in sports that year. And there was a total of less than 10 potential cases of CTE, cases where a high school athlete died in a car accident and 2 cases committed suicide, where they did a brain autopsy and found some regions of the brain where this tauopathy was identified. And again, the question is, there might be hundreds of thousands of athletes out there or non-athletes that might have this as well. So the question is, are these incidental findings? And again, one of the conclusions of this